Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe, alongside Erica Jones in the studios of Civic Center TV and 89.3 Lakes FM, our flagship stations on the Oakland County Megacast network of community television and radio stations. It's not just your regular radio or TV broadcast, not just a simulcast, and not just an online broadcast. It's a kind of combination of all of those with community television, radio, and other media outlets partnering together to bring you the latest news and information from around the Oakland County area. In addition to our flagship stations, we are also on 88.1 WBFH, The Biff, and in Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin. We are on Birmingham Area Municipal Access. And today, it is an OU Friday. Once again, we are on the Facebook page of Oakland University via Facebook Live, and we thank their entire team over at Oakland University for joining us on Fridays such as today, and thank them for partnering as we continue to bring the latest news and information about COVID-19 and other top stories in the local area Monday through Friday from 10 a.m. to 12 noon on this program. Making news today on civiccentertv.com/coronavirus, Governor Whitmer expands her mask order to include young children. Governor Gretchen Whitmer has adjusted her mask-wearing executive order to require kids over 4 years of age to wear masks in indoor public spaces and encouraging all kids over 2 years old to wear masks when indoors as well. Additionally, in childcare settings such as camps, staff and children above 12 years old are required to wear masks in indoor places such as cabins and classrooms. Governor Gretchen Whitmer said these changes align with other guidelines for facial coverings in schools. These adjusted requirements go into effect on Monday, August 10th. Facial coverings such as masks remain a recommendation in northern Michigan and Upper Peninsula regions 6 and 8, and they are required in all other Michigan Economic Recovery Council, or MERC, regions of the state as per the Michigan Safe Start Plan. So Governor Whitmer now expanding her mask order to be a little more strict in public places for children, particularly in childcare settings, as childcare becomes even more of an issue during the pandemic, as parents are going back to work and having to find ways to occupy their kids' time while they're either at some camps that are still open or in childcare facilities, and the chances of spread through new interactions with a large number of other people, even among children, a concern for the governor.
You know, such a common topic of discussion is how children can spread this virus, and it's very important for people to know that children are not invincible to this, and even though they might not necessarily die from it, they still can be spreaders of it. So I think it's very important that these orders are being put into place specifically to make children wear masks as well, because that will stop them from getting it as frequently, and if they don't get it, they can't spread it. So I think it's very helpful that she put this order into place.
The governor putting extra precautions in place as Michigan's coronavirus new case numbers, the average numbers of new cases in the state of Michigan continue to be at around the same level, that they have plateaued as of the last couple of weeks, as was reported earlier on this week at the governor's press conference, which you can see on civiccentertv.com/megacast. But they want to take the Governor Whitmer, Dr. Jonae Caldoun from the Michigan Department of Health and Human Services, and the entire team on the state level responding to the COVID-19 pandemic is still taking as many precautions as possible in order to make sure that the spread of the virus does not continue, and that that curve that we're seeing plateau begins to decrease new cases going forward. Other stories at civiccentertv.com/coronavirus. Attorney General Dana Nessel looks into COVID-19 compliance of nursing homes. Attorney General Nessel's office is cracking down on violations and non-compliance with COVID-19 guidelines and regulations for nursing homes and long-term care facilities. With 1/3 of Michigan's COVID-19 deaths stemming from nursing home residents, Nessel said in an article from the Detroit News, quote, "My office is prepared to continue our role of enforcing the law as this virus lingers and as Michigan's most vulnerable populations remain at risk." Michigan, and closed quote. Michigan's Department of Licensing and Regulatory Affairs will forward violations and complaints to Attorney General Dana Nessel's office for review, and any necessary punishments as a result of violations of COVID-19 safety guides will be decided at that time as well. So Erica, Dana Nessel also taking a little more of an aggressive move toward non-compliance, as Governor Whitmer put more emphasis on state departments to enforce these COVID-19 guidelines, as cases have plateaued, but they want them to be decreasing.
Right, and again, I know we heard Dr. Khaldun say at the press conference earlier this week how cases plateauing is not a reason for us to let our guards down, because even though they are plateauing, they're still plateauing at a much higher number than we would like them to see. So that does not mean that we need to let our guards down, because plateauing just means they're steady, doesn't mean they're going down, and it doesn't mean things are necessarily getting better, because lots of people are still getting it. The number is high that it has plateaued at.
Not only Dana Nessel's office and other state-level departments, but local departments and county departments are also cracking down on non-compliance. And that brings us to our next story. Local gyms are defying the executive orders and remaining open. Despite being on the list of categories of businesses not permitted to be open under Governor Gretchen Whitmer's Executive Order 2020-110, multiple powerhouse gyms in metropolitan Detroit have remained open, including one location in West Bloomfield Township that has received multiple communications to cease operations per the letter of the law. West Bloomfield Township Supervisor Steve Kaplan, in an article from the West Bloomfield Beacon's Mark Vest, said that the township's responses from the powerhouse gym were essentially, quote, "It's thank you for your input," and close quote. Oakland County spokesperson Bill Mullen says the county is aware of the West Bloomfield and other locations that are open in violation of the law and have notified these businesses, copying Michigan Attorney General Dana Nessel, and says that enforcement, quote, "ultimately rests with the state of Michigan," and closed quote. So even on the local level, we're seeing still some non-compliance, a lot of businesses willing to take on the fines and possibly other misdemeanors as well from local departments, as the state government's ultimately the one that's going to crack down on this in terms of licensing and regulatory affairs, maybe threatening to pull those business licenses, staying open despite that being a violation of one of Governor Whitmer's executive orders.
You know, the thing that I still have trouble understanding, aside from it just being wrong and disrespectful to so many people in the community and our government to stay open when orders prohibit that, the reason that a lot of these places want to stay open is because they say that, you know, they can't make money if their businesses are shut down, but they're well aware of these fines that they're going to have to be paying as they remain open despite law enforcement not allowing that. So I think, or the government not allowing that. So I wonder if they understand that those fines eventually could surpass any business that they even are making if they stay open for a certain period of time.
It's an interesting question, but at the same time, gyms make their money off of membership fees, and a lot of them have been asked to or have decided to suspend those fees while they have been closed, and so reopening allows them to bring in that steady revenue and potentially bring in new members as people are itching to go back into the gym. So maybe in that case they see the risk as being better than the risk is being lower than the reward, although they're not taking into account as importantly the public health nature of those decisions. Lastly, civiccentertv.com/coronavirus. Senator Gary Peters opens an investigation into Postal Service cuts. Michigan U.S. Senator Gary Peters, who also serves as the top-ranking Democrat on the Senate Homeland Security and Governmental Affairs Committee, has opened an investigation into cuts to the U.S. Postal Service as delays in processing and delivery of U.S. mail have continued to be issues across the nation. On Thursday, Peters encouraged people to contact his office regarding issues in the delivery of mail, and, as quoted in an article from the Detroit Free Press's Todd Spangler, said that he would, quote, "be working to get to the bottom of any changes that the new Postmaster General may be directing that undercut the Postal Service's tradition of effective service," and closed quote. Many clerks, including Oakland County Clerk Lisa Brown, had recently encouraged voters to hand-deliver their absentee ballots to their local clerks as the August primary election approached, concerned that those votes would not be counted if delivered beyond the poll-closing deadline on Election Day. About 2.5 million people voted by absentee ballots on Tuesday's primary election, and initial statistics show about 10,000 ballots were rejected, although it is unclear at this time how many were rejected due to late arrival to their local clerks. And this is an issue that a lot of clerks are working on, and even the state secretary of state level is also working on how to get around some of these absentee ballot issues, the timing of counting these ballots. And Ronnie and I spoke on this yesterday on the show. that can be a little bit thrown off because of the rules they have in terms of when they can open these ballots and when they can start counting these ballots. But that's one step. You got to get the ballots to these clerks first, and especially as we're going into November in a presidential general election, which is always a very contentious time for voters. That's going to be even more critical, and that's why this investigation is being opened.
Yeah, it really, it's a hard conversation, but I think one way to at least help with this issue is definitely the easily available drop boxes that I've gone out to several times and reported from. And so many of the local clerk's offices, maybe even all of them in Oakland County, have these easily available drop boxes where people can just drive up and put their ballot in them. And I think that's a great way to make sure that they get there, they're accounted for. You don't need to worry about any mishaps with the mail or delays in the mail. And it's just so easy, even if you're unable to do it, find someone that can run there for you. So quick and easy. Don't need to get out of your car. Just drop it in. Very safe and secure. So I definitely think people need to be made aware more so of those.
We've seen great efforts be put forth by clerks on the local level, on the county level, and all throughout the state to ensure that absentee voters, especially as we've seen record turnout in the primary elections, and we're expecting even greater record turnout for the general election by absentee ballot during this pandemic. They've been doing a great job, and we'll definitely keep in contact with them as we approach November, and we'll attempt to get in contact again with the Secretary of State's office for more updates, and we'll keep you posted on that. Other news and information you can find online, civiccentertv.com/coronavirus. In addition, we have links to reputable resources on COVID-19 from the Centers for Disease Control and Prevention, the state of Michigan, Oakland County, and many of your local municipalities. You go to our website, civiccentertv.com/coronavirus. No matter where you live in the area, we'll be able to give you direct links to COVID-19 information from your local municipality. So if you're listening to us in Troy, if you're watching us in Keego Harbor, or if you're throughout Oakland County and want the information on Oakland County testing sites, we got links directly to those sites, so you're not surfing around the internet searching for the right information. It's right there for you. civiccentertv.com/coronavirus, your home for coronavirus information in Oakland County as we continue to cover the coronavirus pandemic as it continues forward in Oakland County, in the state of Michigan, in the United States, and all throughout the world by talking to reputable guests and experts from throughout the local area on a variety of topics, so we can tell the stories of the people of our community and the systems in our community as we battle through this historic time. People such as our first guest today, who is Nancy Jensen. She is a nurse practitioner and the director of the Graham Health Center at Oakland University, joining us now on the Oakland County Megacast. Nancy, thank you for being with us today.
Well, thank you for having me.
Appreciate having you on over the course of the pandemic. How are you? How's your team at the Graham Health Center?
We're all doing well. We're all busy, but we're all doing well. Thank you for asking.
So it has been a busy time for the entire medical community. We obviously thank everyone involved on the front lines and those that are on the second lines even and third lines down who are working on combating this issue on the local level, on the state level, and on the national level. So according to my notes, you have been preparing Oakland University's health outreach efforts since the beginning of this pandemic. What sort of work has that entailed? How has Oakland University and the Graham Health Center been working on outreach efforts in fighting the pandemic over the course of time?
Well, we're getting our campus ready. We've put in quite a few changes and protocols that should help reduce the risk. Some of these changes include a daily health screening that students, staff, and visitors must complete that will really indicate whether they are having any symptoms of COVID or have been exposed to COVID. We're also having students and staff take a daily pledge that they will follow the important daily behaviors that keep us all protected. We are ensuring that everybody wears a face covering while on campus. That's very, very important. And we are also, having signage put up around campus to enforce these important behaviors, not only the face masks, but social distancing and hand washing. We've ensured that the classrooms, the desks are 6 feet apart, that and in housing, there's less density. for students living on campus. We have enhanced cleaning measures as well. And also we have testing for students that will be living on campus. So we've been busy getting prepared.
Something that made news this week was Oakland University's availability of what are known as bio buttons. It's optional for students, as was reported. They can wear these buttons that are tracking various health measurements and helping the university, in this case, track how COVID-19 maybe is impacting the student body. Helps, of course, with contact tracing. Do you have any details on why these bio buttons may be more effective in tracking in tracking coronavirus information on Oakland University's campus, and why it may be beneficial for students to opt in to using these devices?
Well, this is just the use of technology in order to track symptoms, very similar to answering the daily health screening questions. So, being a university, we want to be on the forefront of testing new ideas and new technologies. So it is pretty exciting. And but the ultimate success will really be based on the student's behavior. So that's really what's going to determine how we keep our risk low.
You've been working in college health advocacy for a long time. How's this year been different? Have you ever experienced anything quite like what we're seeing now during the pandemic? And how will this help in your advocacy for health advocacy in the future?
That's a good question. Very good question. I started my career, actually, I graduated from Oakland University many moons ago. And when I first started at the public health department, I was on the forefront of the HIV epidemic. And that brought many challenges to the healthcare system and society. And I do, recall going through that and how it's so difficult for everyone to adapt to these new behaviors. I remember when I was a graduate nurse, we didn't wear gloves drawing blood and giving shots. And we had to make that one change as well as many others. So right now we all have to adapt to new behaviors to keep everybody safe. And it is a unique challenge for this generation, for the young adults. But I know that they're up to that challenge, because I know young adults, college students, and many people, they do care about people around them. One thing I would say is when I see patients here in the clinic, students, if they're sick with an infection like strep throat, whatever, they would often ask, well, should I not go to class so I don't make other people sick? That's a common statement. And it just showed me every day how much students care about each other. So I know now with this pandemic that I know students will be up to the challenge to wear a mask, stay 6 feet away, wash their hands. And also they need to stay home if they're sick. That's very important. And they also need to be sure to cooperate and answer the phone, because it could be somebody calling them to either tell them that they may have been exposed to COVID and might need to quarantine. Or, they could be waiting for their test result and find out they're positive. And then they need to, to help the professionals at the health department, the professional contact tracers, reach out to their potential contacts, always very confidential at the health department. They never use names, but it's important that everybody cooperate with answering these important questions so we can really limit the spread of any infection on campus and anywhere in the community.
Nancy Jensen, thanks again so much for being with us today. Erica Jones here, and I'm wondering, Obviously, we want to keep students in the classroom as much as possible, safely, socially distanced, but I'm a college student as well, so I understand that this is very difficult. Does Oakland University have a specific number or percentage of cases that you would need to reach in order for the administration to say, this is too much, we need to shut down campus completely, we cannot have students? Or is it kind of just a play it by ear situation? Are there hard not deadlines, but are there hard numbers on that?
Well, you have to remember, it's not about a number, because if you just pick a number, any number, once you reach that number, what if it took you a whole year to get to that number? Let's say 50. Well, after a year or two, it's 50, then you close down. I mean, clearly that you can't have a number. But what are some of the parameters are the rate of infections, the ability, the capacity of the healthcare system, both a Graham Health Center and local hospitals to provide care. And also for students to be quarantined and isolated. What's the capacity, at the university? Although, we do really, really insist that students who live on campus who are sick or in quarantine go home where they can be monitored by their family and by their primary care provider. So we don't have a magic number. It's more of a group of indicators.
Nancy Jensen with us. She is a nurse practitioner and the director of the Graham Health Center at Oakland University with us on the Oakland County Megacast. So, Nancy, if someone does test positive, if a student does test positive at Oakland University as we come back in the fall or even in the present day, what is the Graham Health Center's protocol beyond that test? What are the next steps that happen after someone does test positive and those results come back?
Right. Well, first of all, we want to make sure that that student is doing okay and that they are under care. They may have come to us for care, or they may have been seen outside of Graham Health Center, but we still contact them to make sure they're doing okay and to know and to make sure they understand what are the red flags and when do they need to worry so that they have to get maybe emergency care. Because people can have this infection and be doing okay, and then one day having some difficulty breathing and need to go for emergency care. So their condition can change quickly. So we want to make sure they understand that, and we do want to make sure that if they live on campus, that they do go home and be monitored by their family and their own primary care provider. We also make sure the health department is alerted, and the health department completes the interview, and so that these professionals can reach out to their contacts confidentially and make sure that those contacts quarantine themselves for a full 14 days. And we do offer care here for anybody who is positive as well. So those are some of the basic concepts.
Nancy Jensen with us. She is a nurse practitioner and the director of the Graham Health Center at Oakland University with us on the Oakland County Megacast. Nancy, do you have any messages for students, maybe parents or others who are watching and listening today or watching on demand as they prepare to send their children back to OU or to other institutions?
I would like to say that, we all need to trust the science. And that means that we should, when the COVID vaccine comes out, I think it's really important that we all get vaccinated, and I hope to have that vaccine as soon as we can obtain it. But prior to the COVID vaccine, I encourage every student and staff, faculty on campus to have a flu vaccine as well. Flu has very similar symptoms to COVID, and flu can also have very serious outcomes for young adults. And we had many cases of the flu last year, so we are a bit worried about the flu making a big comeback and having people with fevers, sore throats, and coughs around campus. Beside the flu, meningitis vaccine is very important. There's a new meningitis vaccine that came out a few years ago, and it's safe and effective, and many students do need that vaccine as well. They can get all these vaccines plus many more at Graham Health Center. And that's an important step to take in preparation for coming to campus, whether or not you're going to be living on campus, is to be sure to get vaccinated and trust the science. It is it's settled. The science is settled. Vaccines are safe and effective.
Ideally, all students that do test positive for COVID-19 will go home and be with their families and have care there, like you said. But what about students that live on campus who may come from out of state or have other conditions where it's not so easy for them to just go home and be with their families or anyone they may live with? Is there a plan for those students? Is there anywhere set aside for them to quarantine?
Yes. We have areas that are prepared for students to quarantine and isolate here on campus. Of course we do. Absolutely. And we understand that can happen. And we're ready to provide care for these students as well. So hopefully we'll have very, very few cases on campus. And it really, depends on all of us working together to protect each other. And I think, to me, one important way of thinking about it is if we all pretend in our heads that everybody we come in contact with has COVID. Just put that in your head. Everybody has it, and behave that way. We will get a handle on this, and cases will go way down. It's a simple concept, but I think that's one way of really, thinking and acting every day.
Nancy, for people that are being cautious, for students, even faculty that are being cautious on campus, as more people are coming back to campus in the fall than maybe have been there in the summer, are there testing sites available? Is there testing available at Oakland University? Obviously, there's plenty available in Oakland County through the health department, but are there going to be any for those that want to limit the number of spaces they go to get tested on campus?
Absolutely. Graham Health Center is prepared to test students with symptoms, or maybe those that have had a recent known exposure. We do have rapid testing, and we do have the testing the PCR testing, which is more sensitive and it's more accurate. So we do have both. We use those, however, only for students with symptoms or have a known exposure. We don't do here in the clinic screening for those without any symptoms. We do refer those students out to other testing areas nearby. There's many of those, especially Oakland County Health Department.
Nancy Jensen with us. She is the director of the Graham Health Center at Oakland University. Oakland University, our Facebook partner today on this OU Friday on the Oakland County Megacast. So Nancy, circling back as we have a few more minutes with you to the flu vaccine. You suggested that all students get their flu vaccine this year, and with the symptoms being as similar as they are in some cases to COVID-19, and with COVID-19 still expected to be an issue without a vaccine through the end of the year, is this year more critical than ever for people to get those flu shots?
Oh, absolutely. And we are prepared to have a lot of pop-up clinics here on campus. The School of Nursing is collaborating with us and helping us set up these clinics, and we're going to be providing no-cost vaccination to students, and we'll be out and about and really encouraging that. So it is really, really critical. We had a lot of flu cases last year, and students, a lot of them were very sick with the flu, and they missed at least a week of classes, had to make up those classes. It's just miserable. So it's so critical to prevent the flu. And I think when you prevent the flu, this year especially, you're going to prevent the fear of, is it the flu or is it COVID? It's going to take us as providers some time to do some testing. What is it? Which one is it? And it's going to be more challenging for us. So if you get the flu vaccine, that really helps eliminate that risk. And I strongly encourage everyone to get it. I always have a flu shot every year. Everybody in my family does. Last year, we administered well over 1,000 doses of flu vaccine, and I never had one student complain of a side effect or any concerns about it. So it is safe and effective, and we will be out there in force providing these vaccinations to the students. And I certainly hope they take a flu vaccine.
Nancy, we're getting so close to students moving back onto campus at Oakland University and other institutions, but in particular at Oakland University, what is the university, and with of course, great help from the Graham Health Center on campus, doing to get students ready to come back to campus in terms of communication, in terms of educating them on the protocols and so on? What is the Graham Health Center and Oakland University doing to prepare these students to come back to campus in the fall, or to come to campus in the fall for the very first time?
I know that our website, Oakland University website, has a back to campus, very robust communication page, and I would encourage the students to go there and keep referring back to that for any updates. And there's regular communication to students, especially those that are going to be living on campus, in regards to testing, because we will be doing testing of students that are going to be living on campus. So there's a lot of communications going on with that. And as I said before, there's signs around campus, and we're going to be providing students, when they move in, a health kit that'll have a lot of information about COVID, a lot of a mask, a thermometer, and so forth. So we'll be doing that as well. So there'll be a lot of ongoing communications.
Nancy, just another couple minutes with you. Nancy Jensen, the director of the Graham Health Center at Oakland University. Before we let you go, is there anything else that you'd like to touch on today, or any other important information that students or families of Oakland University, even faculty coming back in the fall, should know?
We have to all work together. It's about personal responsibility, and it's about caring for others. That if one person doesn't follow these important protections, these layers, it's almost like we have layers of measures put in, not one of which is perfect. Just wearing a mask is not perfect. Just staying 6 feet away is not perfect. Just washing your hands is not perfect. But if we all do these all the time, it will go a long way to really reducing the number of cases. And I know that nobody wants to be the one to say, oh, I didn't stay 6 feet away, I didn't wear a mask, and then I contracted COVID, and I gave it to my friend who gave it to his grandmother, and his grandmother died. I know nobody wants that, but we have to remember that those are the things that can happen if we're not all every minute of the day following these important guidelines. So I know the students can do it, and I know they want to do it. We just have to all remind each other, or make it a social norm to do these important things. We have to trust that this is the best way to go right now until the vaccine comes out. But even when the vaccine comes out, these behaviors will need to stay in place.
Well, Nancy, we appreciate having you on with us today.
Well, thank you for having me.
Thank you. It's been a pleasure. Nancy Jensen, she is the director of the Graham Health Center at Oakland University, with us on the Oakland County Megacast. And Erica, as a college student getting ready to go back to school, is, especially in these times, so stressful for students, and definitely a time of hustle for these colleges and universities as they're preparing to bring students back during unprecedented times in history, and having to focus not only on the educational side, but also on the public health side, because you don't have a student body if your student body is ill.
Yeah, it's very, very hard, and families are definitely having to make hard decisions. There are lots of students and families that will not be returning to campus this fall, and I definitely think when I'm back on campus, it's going to look completely different. My school in Florida, especially where things are much worse, they're setting very clear guidelines, and they want people to know that campus is not going to look the same way it has in the past, and I'm sure that's the same way for all universities, because we don't want kids to have a false sense that they're going to come back and be able to live their normal college lives, because that's just not the case. It's not safe, and people need to know that and be prepared for what is to come when they step foot back on campus.
And I think that college students also need to be prepared to take a semester off the usual college life, maybe, because as fun as that is, and as important as that is for the experience socially that you have, at a college or at a university, in the times that we're in right now, you're not going to have those opportunities, or you're going to have significantly less of those if you're not taking the necessary precautions. Well, when we come back, we will be speaking with someone from the Henry Ford Museum of American Innovation. We'll talk about how our museums are working their reopening during the COVID-19 pandemic and helping to engage the community in a number of ways. That coming up and more, where you are watching and listening to the Oakland County Megacast on our family of TV and radio stations. Erica and I will return after this break.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft alongside Erica Jones in the studios of Civic Center TV and 89.3 Lakes FM, our flagship TV and radio stations on the Megacast network of community television, radio, and other media outlets. Today, as always, joined by Birmingham Area Municipal Access, also on Comcast, Channel 15 and AT&T Channel 99, as is Civic Center TV. Also, we're joined by 88.1 WBFH, The Biff. You can check out more information on them on WBFH.FM. And today, our Facebook partner on this OU Friday is Oakland University. We thank them for joining us, and we thank Nancy Jensen, our first guest, for joining us as well and giving an update on how Oakland University is preparing to reopen their campus in the fall for regular studies in a hybrid nature, as we've previously spoken with Glenn McIntosh about. We're now being joined to talk about the reopening of another institution in our local area, Henry Ford Museum of American Innovation. We're pleased to be joined by their general manager, Cynthia Jones, now on the Oakland County Megacast. Cynthia, thank you for being with us today.
Oh, thank you, and good Friday morning to you all.
Oh, yes, it's a happy Friday here in Oakland County. For those who are unfamiliar, what is the Henry Ford Museum of American Innovation, and what can people expect when they go to the museum?
So for many locals, you all know us as Greenfield Village, and we are Greenfield Village and oh so much more. So I have the great pleasure of leading Henry Ford Museum of American Innovation. We're an indoor museum, about 9 acres inside. We have amazing American history artifacts, everything from the Kennedy limousine, other presidential vehicles, an amazing Lionel train display that kids love. We have obviously a huge car collection, Rosa Parks bus, and all sorts of social justice oriented pieces about our history of politics. Just an amazing display of artifacts.
There's so much history that's there, and of both Metro Detroit's history especially, but also the history of our country. And there's such a variety as well. If you're into automotive, there's tons of automotive history there at the Henry Ford. If you're into social justice movements, the civil rights movement especially, there's a lot of history there. And if you're just into landmarks as well, there's a lot of different artifacts and things that you can engage in at the Henry Ford Museum of American Innovation. But the pandemic had to have changed that dynamic a little bit. It's a very hands-on, very in-person museum. What changes were made over the course of the pandemic to allow the public to still engage with these pieces of history, engage with the Henry Ford Museum without being on site necessarily?
So we really had to reinvent our business completely, as did so many other businesses. And I think a lot of times you think of a museum and you think, oh, it's just, you walk past objects. Well, we have been known as and prided ourselves for many years on being a very hands-on experience. We wanted you to get up close and personal with history, understand how objects work, do a lot of STEM-oriented hands-on programming here. All of that had to be reconsidered. And so early on, I made this kind of move in my head, and then we started talking about how to do it. How do you move from hands-on experiences to minds-on experiences? So how do we continue to inspire and innovate and work with people so that they can walk away from an experience with us and want to make their life better? So how do we encourage people to be the innovator? And so we really started with that mindset of going from hands-on to minds-on. That was our basis. And then thinking, overlaying everything we do with a layer of safety and consideration for all of our guests, our staff, and our volunteers.
Cynthia Jones with us. She is the general manager of the Henry Ford Museum of American Innovation with us on the Oakland County Megacast. So the museum now, it's been reopened. What's different now than previously in terms of it being an open museum? I would assume that there are some safety measures in place and that reduced capacity is also being enforced.
Absolutely. So we're 5 weeks into our reopening, and we've learned a lot over those 5 weeks. We started out as limited as we possibly could be, and we said to our members, our first opening weekend was with our members, and we invited their feedback. We learned from it, and we've been engaging more activities over time. But a lot of the things that we started with are what we plan to keep as our operating model for many months to come. So we opened with reduced capacity. We're operating at about 25% capacity. We opened up with timed tickets for our membership for Greenfield Village. Now for the museum, our members can come anytime. For our Marvel exhibition, which we opened up 3 weeks ago, we have timed reservations for that, reduced capacities. We've also done a lot of things that just change our flow, that change how people experience us. So we were a very high volume tourist destination. We had 1.8 million guests every year, and we had to think about how people were visiting us. And so we've had to encourage people to get their reservations in advance. So we're pushing a buy online. That way it can be a touchless experience. Once you come into our venue, we don't need to transact cash with you, just a click and you're through the gate with us. We also have social distancing. So we like to think of our social distancing as, staying the distance of Henry Ford's first car, the quadricycle, apart from each other. So about 6 feet. We require masks or face coverings for all of our indoor venues. And then we've vastly increased and changed our cleaning protocols. So we were already known as a sparkling clean facility. Now what we do is we just have very stringent requirements on how that happens. And every staff member is now part of the cleaning team. So we are all engaged with it.
Cynthia Jones with us on the Oakland County Megacast. She is the general manager of Henry Ford Museum of American Innovation. And so the museum is now reopened. There are different measures in place to make sure that you're limiting the capacity, that the facilities are safe and clean regularly, as they've always been known to be. But virtual programming, people are still looking for that, as some are not comfortable just yet going back out to physical museums or other places that they would venture, and some have come to prefer virtual experiences over the course of the pandemic. What virtual experiences maybe are still in place at Henry Ford Museum?
So we came into the pandemic in an excellent position to be able to launch, and we're already doing some online engagement. So we were lucky. A number of years ago, we started digitizing our artifacts, our collection, And we have about 90,000 of our objects already digitized, available for us to teach from, to work with. We had just a vast array of digital experiences out there already. So we came from a good place. And what we said was, let's take the best of what we do and let's think about what our guests, what folks at home need right now. And so in March, April, May, we really focused in on schooling. How were parents, how were caregivers helping those students who were suddenly home? How could they use our artifacts? How could they use our storytelling to have really good engagement, to have incredibly vibrant learning happening at home? So we did that all the way through May and early June. And then, the summer came around, and I don't know about you, but for me, I didn't want to be in front of my computer quite as much. And so we changed that learning and we said, okay, let's make it still have the vibrant, incredible online engagement, but we launched an innovation challenge for the summer. So each week we give students and families, anyone who wants to participate, on Mondays, we give kind of an online rundown of some object that we've chosen in the collection. And then we issue basically an invention challenge so that you can go out, really, work in your own backyard and think about how can you build like our famous inventors? What can you make better? Because we also want that online work that we're doing to be inspiring. I think all of us right now, we need that sense of uplift, that sense of empowerment that you can too, that you can be an inventor, that you can be Rosa Parks, that you can be Buckminster Fuller and design a completely different style of house. And so we're really using things like that to do that. So we continue to do online reading. We continue to do great storytelling. We've got the invention challenge going on. And then all sorts of artifacts and things you can access on your own.
Cynthia Jones with us on the Oakland County Megacast. She is the general manager of Henry Ford Museum of American Innovation. So Cynthia, going forward, with all that Henry Ford has learned and with all the pivots you've made for virtual programming, do you imagine that that's going to be a regular part of what Henry Ford offers going forward?
Absolutely. So, I have the great privilege of leading our museum program team, our exhibitions team, as well as the Ford Rouge Factory Tour team. And, one of the commitments we had made was that every move we're making right now with our learning and engagement team to digitize and to be online needs to marry what we're doing physically in our venues. Partly because we know, you said it, there's a lot of people who have learned that they can visit us virtually who may never have had a chance to visit us before. So folks who can't get out and about right now, as well as those who are not quite comfortable getting out and about right now, we want to maintain that audience and we want to build that audience over time. So every program that we're developing now, we ask ourselves, what is the online component? What's the in-person component? And how can those feed each other and be made better? So for instance, we had kicked off kids storytelling time, it's been super popular. We read books related to our artifacts and then, really dig into them. Just super fun for the youngest crowd. Now what we're looking forward to is how can we bring that storytelling time, which has been happening from the couch of one of our learning engagement team members' house, how can we bring that into the museum so that the story is read in front of, a massive train, if it's about a train, or in front of the Rosa Parks bus, if it relates to that, and create that, that additional engagement, that additional layer of interest for folks, and how can we dig deeper? So we're really thinking about that. We also have had a long-standing engagement with lots of different folks in the community. So we work with the autism organization here in Michigan. We work with the dementia organization. We work with folks that are blind or vision impaired. And so we've also asked our constituency in folks like that to help us make sure that our programming going forward serves a huge range of communities as well. So we're really digging in on that and thinking about how to make that programming the best it can be and serve everyone we can.
You mentioned that you have about 1.8 million guests per year, and that's crazy huge number. So you want to keep everyone engaged and satisfied with what you're doing during this time. How has the feedback been from some of these guests, or maybe even regular guests that for years and years have been coming to the facilities? What have they been saying? Are they happy with what you've been doing?
Yeah, it's a great question. So, one of the beauties of moving to online ticket purchasing and member reservations online was that we had your email. So we immediately instituted a follow-up online survey for all of our guests. And so from day one of reopening, we've asked every person who's come, would you just fill out a short survey for us? Will you tell us what worked, what didn't work, what we can make better? And the feedback has been phenomenal. Both things that we've learned from. One of the ones we're still working on is we have frozen custard here. And the way our frozen custard shop is set up, we really tried to reduce our touch points and make it as safe as possible. For us, that meant eliminating sprinkles. Turns out sprinkles are something people really want on their custard. So we're trying to solve that one. But the other feedback we've heard has just been amazing. We have over 90% of our guests rating us the highest rating possible for our hospitality and our safety. And so for my team members, we share that data with them. We let them know what they're doing right, because this is not easy. It is not easy to come back and be open in this time. It's scary for our staff members. They've, developed confidence over time, but, they need to hear that good stuff. And we need to hear the how do we make it better part, because we are actively listening.
Cynthia Jones with us on the Oakland County Megacast. She is the general manager of the Henry Ford Museum of American Innovation, which now features a new exhibit, a Marvel exhibit, The Universe of Superheroes. Cynthia, can you tell us a little bit about that exhibit and when it will be available to the public at the Henry Ford?
Absolutely. So right before we shut down for the stay home, stay safe orders, we were finishing up building Marvel. It is a phenomenal exhibition. And, so this whole time that we were shut down, we're like, oh no, what are we going to do? Is Marvel going to be able to open? Are people going to be able to enjoy it or not? So the first thing we did was we extended the run of Marvel. It is now going to be open at the museum all the way through January 31st. So folks have a long time this summer and then this fall and across, through the Hanukkah and Christmas holidays to really have a chance to come visit us. So that's great. But Marvel is, I think, the perfect exhibition for right now. It's about 10,000 square feet, so it's a huge exhibition space, over 300 artifacts in it. And more importantly, it's an inspiring story. So you can come in and you can really have a great family visit. What we're noticing is that people are coming with all sorts of different ages in their family all together. And they're coming to visit Marvel, and everybody finds their favorite superhero. And you get to just have fun together, which I think that matters right now. I think it matters to take a break, that it matters to come to a place where you can feel confident that we're doing our best to take care of you and just have a good day out. So Marvel is awesome.
Cynthia Jones, the general manager of Henry Ford Museum of American Innovation. My apologies. Just another few minutes with you, Cynthia. Is there anything else that would be important for our audience to know that you'd like our audience to know about the Henry Ford, or anything else you'd like to touch on today?
So I think it's important to know for Marvel that it's selling out. So you need to reserve your tickets online in advance, figure out which day you want to come and reserve. We were able to extend the indoor museum's hours because of Marvel. So we were sold out. We had originally opened Thursday through Sundays, limited hours, limited staffing, all sorts of things. We were able to open up the museum for 7 days a week because Marvel is so popular. And it's very interesting to see. This was our first week back open, 7 days. Monday, Tuesday, it was fascinating because we had all sorts of, college-age students coming to visit us because those are their days off. And so they were able to come and enjoy. So I think make your reservations online in advance. Think ahead about what you want to do. Maybe take a break this August, come out on a Monday, Tuesday, Wednesday, come out on the weekend. I think that's good to know. For Greenfield Village, I'll just touch on that real quick. Lots of folks love to come to Greenfield Village. It's open acreage, lots of space to move around. Our museum is mask on because we're indoors. Greenfield Village, you get to be mask off as long as you can stay socially distanced. And then put your masks on when you go inside, when you're around our staff members. I think we're trying to be as flexible as possible, give people choices about what to do with us this summer.
So with Marvel being such a great place for people to go and get an escape from everything that's going on right now, do you personally feel that this has been a rewarding experience, that you've been able to play such a huge role in giving people these opportunity to have something like that during a pandemic?
I absolutely do. I mentioned it earlier. My staff members, my volunteers, they were a little nervous about our reopening, and we take their comfort very, very seriously. I made a commitment to my team from day one that I would be on the floor with them, that I would be out there with them, that I will never ask them to do something that I'm not comfortable doing myself. And so I've been on the floor a whole bunch the last 5 weeks, and I've been side by side with my staff. And every time we get to be in Marvel and we see a family come in and they take us aside and they say, this was our first time coming out in public. That's a sacred trust. That is something that we take very seriously, that they chose to make that first venture out, masked up, socially distanced, washing their hands, doing all the right things, that they chose to do that with us. That is sacred. That is really something that hits you in the heart. And then to get to see their joy, to get to watch the kids, we have this interactive where you get to become Iron Man. It's a totally touch-free virtual interactive. They absolutely love it. And so to just hear laughter, to see joy right now, that makes you feel pretty good that you're doing something right.
Well, Cynthia, thank you very much for being with us today.
Absolutely. Thank you all so much, and stay safe.
You as well. We appreciate it. Cynthia Jones with us. She is the general manager of the Henry Ford Museum of American Innovation with us on the Oakland County Megacast. And Erica, there's so much there for people to engage in, and they've provided a number of opportunities for virtual engagement as well for people that are still maybe not comfortable going back out, but want to engage in the community and engage in learning and history.
Definitely. And I think everyone feels differently about this pandemic. Everyone's comfort level is different. Everyone lives with different people with different pre-existing conditions, and you don't know what someone's dealing with at home. So I think it's very, very crucial that everyone's respectful of how different people feel, because we can't assume, even when facilities do open up, that everyone feels comfortable, because not everyone does feel comfortable going out. So it's so important that we still do have virtual options, even though places are open for in-person visits.
Find more information about the Henry Ford Museum on thehenryford.org, and we thank Cynthia and her team for joining us today on the Oakland County Megacast. We'll take a quick break. When we return, we'll talk about high school football and more. You are watching and listening to the Oakland County Megacast on our family of TV and radio stations. Erica and I will return after this quick break.
Hi, I'm Dr. Faust, the medical director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Michigan, the coronavirus pandemic has put us all to the test. And now, it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our Test Locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services. Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Erica Jones in the studios of Civic Center TV and 89.3 Lakes FM. In addition, we are on 88.1 WBFH and Birmingham Area Municipal Access. Today, we're on the Facebook page of Oakland University via Facebook Live, and we thank their entire team for allowing us to once again broadcast with them on this OU Friday on the Oakland County Megacast. And we want to just go through some of our own online assets that you can utilize to find more information on the coronavirus and other top news stories in our local area. Of course, civiccentertv.com/coronavirus. You can find information from reputable resources such as the Centers for Disease Control and Prevention, the state of Michigan, and Oakland County regarding the coronavirus, and your local municipalities as well. Then, if you go to civiccentertv.com/megacast, you can find more information on the Oakland County Megacast, what this show is, what we talk about, information on our partnering TV and radio stations as well. Submit ideas for us to talk about, for people for us to talk about and talk to on the show, our fill-in form here on civiccentertv.com/megacast, and watch full episodes, short clips, and full interviews on demand. So if you're tuning in just now to the show and you want to hear the really interesting interview we just had with Cynthia Jones from the Henry Ford Museum of American Innovation later on today, that will be posted on civiccentertv.com/megacast, and you can click on watch full interviews and see that entire interview. But maybe you don't have time to watch an entire 2-hour show or 20-minute long interview, 15-minute long interview. You just want to get the best information, the quickest information possible. We have short clips also available to you, civiccentertv.com/megacast, where we have all of our interviews from the Oakland County Megacast, as well as Governor Whitmer's press conferences, such as the one she had earlier on this week alongside Garland Gilchrist, the Lieutenant Governor, and Dr. Jonay Caldoun, as well as Mayor Neely of the City of Flint. All that online, civiccentertv.com/megacast. And for coronavirus news and information, civiccentertv.com/coronavirus. We're going to take one more quick break. When we come back, we'll talk to Ron Bellamy, the head coach of the West Bloomfield Lakers high school varsity football team. That coming up next on the Oakland County Megacast. You're watching and listening to us on a family of community television and radio stations, including 89.3 WBLD Orchard Lake, West Bloomfield, Keagle Harbor, Sylvan Lake, and 88.1 WBFH Bloomfield Hills. Megacast returns after this.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Erica Jones in the studios of Civic Center TV and 89.3 Lakes FM. We're also joined on the Oakland County Megacast each and every day by 88.1 The Biff out of Bloomfield Hills, a service of the Bloomfield Hills School District under the leadership of Station Manager Ron Whittables, and Birmingham Area Municipal Access, which you can tune into on Comcast Channel 15 and on the Community Television and Public Access Guide on AT&T Channel 99. To watch our live episodes of the Oakland County Megacast from 10 a.m. to 12 noon, Monday through Friday, as we bring you the latest news and information from around Oakland County about the coronavirus and other top stories, including our top story today on civiccentertv.com/coronavirus. Governor Gretchen Whitmer expands her mask order to include young children. Governor Whitmer has adjusted her mask-wearing order to require kids over 4 years of age to wear masks in all indoor public spaces and encouraging all kids over 2 years old to wear masks when indoors. Additionally, in child care settings such as camps, staff and children above 12 years old are required to wear masks in all indoor places such as cabins and classrooms and so on. Governor Whitmer said these changes align with other guidelines for facial coverings in schools. These adjusted requirements go into effect on Monday, August 10th, and facial coverings such as masks remain a recommendation but not requirement in northern Michigan and Upper Peninsula regions 6 and 8. In addition, Attorney General Dana Nessel is looking into COVID-19 compliance of nursing homes. Michigan Attorney General Dana Nessel's office is cracking down on violations and non-compliance with COVID-19 guidelines and regulations for nursing homes and long-term care facilities. With 1/3 of Michigan's COVID cases stemming from nursing home residents, Nessel said in an article from the Detroit News, quote, "My office is prepared to continue our role of enforcing the law as this virus lingers and as Michigan's most vulnerable populations remain at risk. Michigan's Department of Licensing and Regulatory Affairs will forward violations and complaints to Attorney General Dana Nessel's office for review and any necessary punishments as a result of violations of COVID-19 safety guidelines," as the governor and her team continue to emphasize compliance with COVID-19 guidelines. And Governor Whitmer, earlier on this week on Monday, she made an executive directive to the state that to say that state departments, including the Michigan Department of Licensing and Regulatory Affairs, the Attorney General's office, the Department of Health and Human Services, and other local departments on county levels and municipal levels also, to put more focus on the enforcement of COVID-19 compliance and the education of compliance. This new directive by the Attorney General to crack down on nursing home violations of COVID-19 regulations is a great example of that.
Education of compliance is so important because I still think, even 5 months into this pandemic, a huge thing is there are so many people that just don't understand the severity and the risks and how easily this virus is spread. And it's very hard because when people don't understand that, they're not going to take it as seriously naturally. So the more that everyone can do to make sure everyone's informed and knows that they need to be playing their part is so important. And I think that's the governor's goal, especially with schools starting soon in the fall. We really need to make sure that people understand the severity of this virus so we can keep numbers down and not have the situation get worse.
More of those stories online, civiccentertv.com/coronavirus. We can find more information on COVID-19, our daily news stories as we post them on there, as well as links to reputable resources on COVID-19 from your local municipalities, the county, the state, and the federal level as well. Well, now let's move on to more things coming up in the fall as COVID-19 continues to be an issue that definitely is affecting high school sports, and we are pleased to be joined once again today to talk about how one team in our local area is working through that. We're joined now by Ron Bellamy. He's the head coach of the West Bloomfield Lakers varsity football team with us on the Oakland County Megacast. Coach Bell, thank you for being with us today.
Thanks for having me.
Appreciate having you on. How have you been since we last spoke, and how's the team doing?
We're doing well. We're excited to get going. We're slated to start Monday, August 10th, and so far we haven't gotten word that we're not going to be held back or anything. So we're excited to start up Monday morning.
Yeah, the MHSAA has put a lot of emphasis on they're going to run these seasons for all fall sports as normally as possible. They want to do everything that they can to avoid ditching another season that's similar to what happened in the spring with spring sports such as baseball and so on, and giving these kids opportunities to play the game they love, because for a lot of these students, this is the highest level they'll ever play these organized sports at, and these can be really important times in their lives and experiences in their lives to help them grow in other areas as well.
Absolutely. For the game of football, for most people, it's a game that, you look for a winner and a loser. In our case, obviously we want to win, every time we get an opportunity to get out there, but we're trying to teach life lessons as well. And we're working on character development, so it's important for us to give an opportunity to continue to work with our young people that we can kind of help instill some values that their parents are doing. And obviously the toughest part is the camaraderie part for high school kids. We're human beings and we like the social interactions, and taking away football and the kids going back to remote learning, you can take away the socialization part that's key for their mental and physical health.
Yes, the social aspects of high school sports are so important, and they play such a big role in the experience and in the success of teams often as well. So the last time we spoke, you were running your practices in cohorts. There was small groups of people at each particular practice, and now we're coming into August 10th where full team practices are permitted for sports such as football. Are you going to be using the same similar methods as you have been previously in other workouts throughout the summer, or are there going to be different regulations in place to have those full team practices but maintain the COVID-19 guidelines as well?
Yeah, for us, we're going to, for the first week, the MHSAA advised, teams to keep the same summer workouts, but the kids are allowed to use helmets. You can get more in traditional football setting. However, for us, we're going to continue to run things like the summer. We're going to have different pods. We will have our entire, we're going to separate our teams, freshman level, junior varsity, and our varsity level. And we're going to, with our varsity level, we'll have, our entire team there. But we're going to, just work more pod group just to kind of, make sure we're self-contained and try to do things the right way and try to extend this thing as long as possible. As far as, the kids not touching each other. And, whenever we get the green light that we can physically, the kids can engage, we'll keep our fingers crossed and hope for the best, but not quite sure not certain what that looks like.
So if I'm hearing correctly, you have not gotten that green light from the MHSAA or from the school district, wherever the powers that be may be placed, to do physical practicing such as tackling, drills, and scrimmaging and so on with your team. How does that going? If that is the case, how does that affect your preparation for playing ball as you approach a few weeks out the start of the season?
Yeah, for us, well, actually, August 17th is the date that they gave us that we can have, full padded practices where the players can be engaged with one another. But we, the biggest thing for us is just to do things the right way, and whatever timeline that we have for the MHSAA, we want to make sure that we are, like I say, doing things the right way. If the virus isn't contained the right way, then things will get pushed back.
Ron Bellamy with us. He's the head coach of the West Bloomfield Lakers high school varsity football team with us on the Oakland County Megacast. And Coach Bell, so we're approaching the beginning of the season. Social distancing guidelines are still going to be in place. The governor's orders only permit 100 people in social gatherings, even outdoor gatherings in the state as of now, with a recent update from a week ago. With that being the case, how will fall games look different on the football end, and how is that possibly going to affect the way that you play ball mentally, knowing that you're not going to have packed stands full of students, a loud student section at the Swamp at West Bloomfield High School, and in many cases maybe parents will not be there to see their kids play as well?
Yeah, I mean, that's the toughest part for us is, having such a great following, having one of the best, if not the best student section in the state, and having a community that supports our football program. And that's going to be tough for us. Our kids feed off the energy from our fans, but nonetheless, they get a chance to put a game that they love. Our games will be live streamed, so whoever can't watch it in person will be able to watch it, digitally, via cell phone or any type of device that they may have. But our kids, they play the game of football for the love of the game, and they play for one another and they play for their school. So we as a coaching staff, I have to do a really good job of encouraging that and making sure these guys understand that we'll do something, man. At least for home games, maybe we'll do some cutouts or something to make it seem like there's fans, and we'll run some noise through the speakers. I'm not sure, but we'll get creative.
Yeah, it wasn't that long ago, just a couple of years ago, that I was a Laker and I was in the student section at West Bloomfield High School, and the spirit at that school, the student section, it's infectious. That energy is completely unmatched. And as a student, all my friends and I, we would look forward to that season all year. So is there no chance definitively that there will be fans in the stands at all throughout the whole season, or is there limited capacity that's being looked at? Do we know yet? Because that Friday Night Lights feeling, again, is just unmatched, and it's hard.
Oh, it's very hard. It's Friday Night Lights. It's a sacred time in the fall for football to be played, and what's neat about it is it brings communities together. It shows the importance of the game of football. You can, even if you're not a diehard football fan, it shows you you could come together for one common cause, and everyone supports everyone. And this is not just in West Bloomfield; this is across our nation. And that's why we love football so much, because of those Friday nights. But for us, I don't know, man. It's we haven't gotten the guidelines. Obviously, Governor Whitmer said no more than 100. So I'm not sure what the MHSAA is going to do according to that. With the fans, we're not sure if each kid gets 2 parents or whatever that may be, or you get one representative. Not sure of that, but we're going to follow the guidelines, and the kids understand that this is a unique time for us, and they understand that things that they're accustomed to is not going to happen. We may not even play a full schedule this year. We may not even play this year. So they're ready for that, and it's my job to mentally prepare them for any and everything that's thrown their way. And we're going to face that adversity face first and do things the right way.
Coach, that brings up an interesting thought for me, just because we had spoken recently with the MHSAA's Director of Broadcast Properties, John Jansen, who had mentioned that to some extent the decisions being made on whether to play a game one week or another may be made on the part of the schools, on the individual teams, the schools, the school districts, and then maybe at the highest level, the MHSAA, if there's a serious outbreak and there's an issue. If there is a situation where someone on your team, God forbid, tests positive, or someone on an opponent, same situation, God forbid, tests positive for COVID-19, and there's evidence of an outbreak, how do you go? What's your process there in the school's process of deciding whether or not you're going to continue on with a game that week, and how does that affect your schedule on the week after that as well, knowing that there may be interactions with multiple teams that stem to that outbreak?
Yeah, great question. For us, MHSAA is going to have a plan for that. I'm guessing that each team this year, we're the only sport within the MHSAA that does not have you automatically make the playoffs. You qualify for a playoff. So, we're the only school. We're the only sport. So this year may be, like I said, it's a unique year where, from my understanding, everyone will have a chance to make the playoffs. It probably will be a shortened season. In the event if a player or players or coaches, acquire COVID and it's a mass spread, each school district, decides, how they're going to handle that. And from my understanding, each school district's in constant communication with their county's health department So I know that we're going to have a plan. We're going to have a diligent plan that's first and foremost is for the safety of all involved. Like I said, like I mentioned earlier, football, we all love it. It's a great sport, brings people together. But at the end of the day, it is a game, and lives are at risk, and we're going to do things the right way. And I think the more you explain that to the kids, to the parents, that it is a game, and then there's a possibility of X, Y, and Z happening. If that does happen, that moment happens, you're not going to blink, and you'll face the adversity like you're supposed to, and as you should.
Coach Bellamy, Ron Bellamy, the head coach of the West Bloomfield High School varsity football team, with us on the Oakland County Megacast. Having been around the team and interviewed a lot of the guys and broadcasting those games, we've seen firsthand at Lakes FM, and our team has seen firsthand that your team is highly motivated, something that your coaching staff does a great job of inspiring in your kids, and your kids just naturally have in them as well as competitors on the gridiron. Is this year different for them? Do you see in your players coming into the season as they're preparing to start this special, unique season under these unique circumstances, that they're even more motivated than usual, that they're even more hungry to win and have a successful year than ever before?
You know what, Tyler? This is my 11th year being a head coach, and we've had the most participants in summer workouts than we've ever had. I think that speaks volumes. I think our kids were cooped up inside their homes for quite some time, and they were ready to. We have a lot of newcomers, and I think a lot of kids kind of gave them that confidence to come out and do something, be a part of a program, and some of the kids chose football. Also, our kids just watching the summer workouts. If you were there in person watching them, you would see kids just relentless. I would call it determined, focused. I'm excited for this year if we do have a football season. Whatever we may have of it, we're going to make sure we're doing things the right way for our kids, and because they deserve it, and everything that we've asked for, the kids have delivered, and I think that's part of the culture that we've developed at West Bloomfield, and something that we're very proud of.
Lastly, Coach Bellamy, on the AstroTurf Twitter page, there's a competition going on for the best high school football field in the country, and West Bloomfield is in that competition. They're going up against another school for the best field. How can people get involved in voting for West Bloomfield and making sure West Bloomfield wins that? And what's in it for West Bloomfield if you guys are declared the best football field in the country?
I'll start off with first how people can get involved in voting. You can follow my Twitter, which is at 19 Bellamy, or you can follow our West Bloomfield School District's Twitter page, and you can kind of scroll through and you can see the link that you can vote for our high school. It's pretty unique. I don't think you win anything, but it's just bragging rights. I know I'm biased in saying this, but I do think that we have a pretty cool football field, different tone, the swamp on the side of our field. Something for us in the West Bloomfield community to be proud of. And our kids love it. We take great care of it. And, I show that being from Louisiana, I've shown some of my high school friends and coaches what our field looks like. And everyone's amazed, by it. And those are the fields that you wish that you could play on. So we're very proud of it. And hopefully everyone can continue to vote for us, and we could keep moving on, and we could get crowned as the best football field in America.
Coach Bellamy, the Big Ten released its schedule this week, its updated schedule for college football. And I got to ask as we're going out, of course, I'm a Spartan, you're a Wolverine, so I have to ask this question. How did your coach Harbaugh pull off such a fast one on the Big Ten and end up getting the Michigan State game switched over to Michigan Stadium this year? How did that happen?
He said that Michigan State, the players wanted to play in front of the greatest venue in the world. So Coach Tucker begged the Big Ten to allow Michigan State to travel again to play in Ann Arbor. I joke. From my understanding, the Big Ten thought it was not fair that Michigan and Michigan State were both playing road games at their respective rivals. For instance, the way the schedule was slated, Michigan State would always travel to Ann Arbor and travel to Columbus to play Ohio State. And the same was true with Michigan. Michigan would always have to travel to East Lansing and travel to Columbus to play Ohio State. So by giving Michigan an additional home game this year, you kind of, Michigan plays Michigan State at home, and Michigan travels to Columbus. So you broke that up a little bit, which I thought was fair. And unfortunately for Michigan State this year, they got to travel to the Big House. But just for 1 year. I want to say a few years back, Michigan did the same thing when they played 2 straight years in East Lansing.
Yes.
So we're returning a favor, and you can play that game in on a neutral site. You can play it on asphalt. That's still going to be the toughest, most physical game around.
Absolutely. Coach Bellamy, thank you for being with us today.
Thank you guys for having me, and stay safe, and let's go Lakers.
Absolutely. Thank you very much. Coach Ron Bellamy with us, the head coach of the West Bloomfield Lakers varsity football team, with us on the Oakland County Megacast. Good to talk to him, get an update on what's going on with the football team. They begin full team practices on Monday, August 10th, and they can begin contact practices 1 week later, and they're taking all the precautions that they possibly can, keeping pods of players, just cohorts of players essentially, practicing with each other to maintain those social distancing measures and safety measures and ensure that these kids are being able to play the game they love, engage in competition, learn from the art of sport, but also do so safely during these unprecedented times. We're going to take a quick break. When we return, we'll talk with West Bloomfield Township Trustee Howard Rosenberg on the Oakland County Megacast. You're watching and listening to us on a family of TV and radio stations. Erica and I will return after this quick break.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
or blue.
But one thing we can all agree on, to help stop the spread of COVID-19. Wear a mask.
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 The ball's in your court, Michigan.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Erica Jones in the studios of Civic Center TV and 89.3 Lakes FM, our flagship stations on the Megacast network of community television, radio, and other media outlets. Today, we're pleased to be joined as always by 88.1 WBFH, the Biff out of Bloomfield Hills High School, Birmingham area municipal access, also on Comcast Channel 15 and on AT&T Channel 99. Today on this OU Friday, we're pleased to be joined by our Facebook partner, Oakland University, and thank their entire team, Brian Beerley, and all of them at Oakland University for joining us on today's edition of the Oakland County Megacast, our last live show of the week, but you can tune in Monday through Friday live from 10 a.m. until 12 noon for our shows each and every day during the work week, and on demand online, civiccentertv.com/megacast, as we continue to talk about the ongoing impact of the COVID-19 pandemic on a variety of different areas, including municipalities and local places of learning such as museums. And joining us now to talk about both of those particular places, we're pleased to be joined by West Bloomfield Township Trustee Howard Rosenberg once again on the Oakland County Megacast. Trustee Rosenberg, thank you for being with us today.
Good morning. You're welcome. Thank you for having me.
I appreciate having you on. It's been a while since we've last spoke. How have you been since we last talked?
We've been well. We've been healthy. Everybody in the family is good. Thank you for asking.
Good to hear. Always good to hear that. The Township Board continues to be hard at work on the variety of township issues. Regular meetings throughout the township are back in place. They're all virtual, but all the boards are still meeting and things are moving forward on the township level. But there's still an emphasis on preventing the spread of COVID-19 in West Bloomfield. How closely have the board members been working with the various departments at West Bloomfield Township and all throughout the community on a county level to ensure that we are continuing to work hard to prevent the spread of COVID-19 in an area that previously, early on in the pandemic especially, was a bit of a hotbed for the coronavirus?
Well, as you said, Tyler, everybody is concerned about it. Everybody is aware of it. It is a scary virus because individual outcomes are unknown. You have a woman who was 103 years old that fully recovered and a young woman in her 20s that had to have a double lung transplant. So it's a serious problem. And because of that, we are all paying really close attention to making sure that we adhere to all the safety issues that we should be. Wearing a mask, maintaining distance, keeping sanitized. Our fire department led the initial controls in the Emergency Operations Center. We were fortunate. We had very few people. We had nobody get sick, really. Currently, we are working under strict conditions, and we are still staying healthy and keeping everybody in the community healthy. Our numbers are way down in the township.
It's really been a great effort on all parts, from the township level to different various organizations in the community, especially our first responders. We talked with Steve Kaplan, the township supervisor, earlier on in the week, and I'll ask you the same question I asked him. Talk about the work that's been done by our first responders, by our police department and our fire department in educating the community and continuing to educate the community on prevention tactics, as well as protecting the community from further spread of COVID-19.
You know, I can do that, but the guy to ask is Deputy Chief Kurt Lawson. He was a public liaison, and he has a laundry list of things that they have done on social media and on your broadcast and through Civic Center TV and radio, mailings. So we have created, frequently asked questions. We've made available disinfectant products if people need them. We've made available personal protection equipment if people need them. We've created a situation where we can bring people food if they've needed it. So we have made sure that every resident in the community was aware of what they needed to do to keep themselves safe and what we could do to help them keep themselves safe.
Howard Rosenberg with us on the Oakland County Megacast. He is a West Bloomfield Township Trustee. With us on the show today, we're joined by a variety of community television and radio stations as we continue to bring you local updates on COVID-19. And Howard, we recently spoke with Bill Anderson from SEMCOG about municipal funding and how municipalities are going to be budgeting not only for the continuation of this year and how things may change, but going into the future, as it's not going to necessarily be this year in 2020, but into 2021, 2022, and so on, that our municipalities are going to see the effects of COVID-19 on a fiscal level. West Bloomfield Township's been working really hard on preparing for those kinds of situations. How is the Township Board communicating to make sure that as you're approaching budget planning season, that you're keeping in mind the impacts of COVID-19 are maybe not going to be seen immediately, but down the road?
We do this regularly. Remember, Tyler, we were through the 2008 Great Recession, where property values dropped 40% almost overnight for the first time since World War II. People understood that there was a problem coming, but nobody understood the extent to the problem. And we got through that, and I was on the town board. Steve was on the town board. Terry Weingarten was on the town board at the time, and we got through that without having to lay off anybody or cut anybody's pay. There was a brief furlough of the non-uniformed people for a short time, but other than that, with shared sacrifices between the union and between our ability to cut budget and unnecessary things. I mean, it wasn't that they were unnecessary. We just pushed them back. We just didn't do them. We had to get them done, and we're beginning to get them done again. But we pushed off buying new equipment. We pushed off buying. We made our fire trucks last another year, so on. So we've been through this, and so we're facing something again that even if it becomes as bad, we're sure we can handle it. We're slowing down our capital spending. We're looking at everything right now. Our assessor, Rob Scripture, does a fantastic job of projecting things. We have a running 10-year projection of our budget that we always look at, and we have a rolling 2-year budget. So we're well positioned to know where we are and not be caught short. Our legacy costs are well funded. Our retirement funds are well funded. Our OPEB, our other post-employee benefit funds are well funded. So the township is in good shape financially and can withstand whatever drop we may have.
Howard Rosenberg with us. He's the West Bloomfield Township Trustee with us on the Oakland County Megacast. In addition, Howard is also a docent at the Detroit Institute of Arts. And we've talked to you previously on in the pandemic about the DIA moving a lot of those classes and services to being virtual, and you were involved in some of those events as well. The DIA has since reopened. Have you been back down there providing your docent services? Are you still going virtual? A little bit of both. How is it different, the experience now for visitors as they're coming back to the DIA?
So Tyler, how many questions can you put into one sentence?
All of them.
I got you. Yes, the answer to the question is yes, I've been back down to the DIA. No, I have not been back down as a docent. Volunteers are not part of the reopening of the DIA. So let me tell you first what, for your viewers and listeners, what the DIA is doing right now in terms of visitor safety. First of all, you need to make a reservation to get into the DIA. It's free, but you need to make a reservation. For all residents in Oakland, Wayne, and Macomb County, there's no charge. But you do need to go to the dia.org website, and you need to make a reservation for a time you want to enter. And you can make a reservation every half hour. And once you're in there, you can stay in there as long as you want. They have limited hours, 9 to 4 on weekdays, I believe, and 10 to 5 on weekends. They're not open late anymore on Fridays. There's no food service. All the restrooms are available, and it's a touchless experience. I got to tell you, I felt safer at the DIA than I do in my, as safe as I do in my own house. When you walk in, you're scanned by a thermal reader to determine that you're not running a temperature. You're asked questions, and you must wear a mask. You're not going to be allowed entry if you're not in a mask. You can stay close to the group you're with, but you have to maintain the 6-foot distance with anybody else. If you have to touch anything, if you want to ride an elevator, there's a staff member there to push the button for the elevator. If you want to open a door to get into a gallery, there's a staff member there to open the door for you. All galleries are one way in, one way out, so you're not crossing over anybody. But you can feel free to walk through to any gallery you want. So staff has been redeployed, paid staff has been redeployed to handle that. When they're allowing 75 people in every half an hour. So their total volume of people will be 20% of the normal amount of people. You will feel very comfortable going down there. They have food trucks outside if you want to eat anything. Same rules, don't touch anything. No food, no beverage allowed in the galleries. Now, as far as the second question, virtual, yes, we're still doing virtual. We developed a virtual interactive program in order to continue touring. So it's called Thursdays at the Museum. You can get on it by going onto the West Bloomfield Parks website. They carry a link. Every Thursday at 1 o'clock, we will present a different theme of pieces from the DIA, and as the audience member, you can ask questions. You can't speak, but you can type in your questions and we'll answer your questions. So that's one thing. The DIA has pivoted staff-wise to having virtual training for teachers, virtual workshops for students. Their entire education programs are now online. So teachers can reach out to the DIA to schedule virtual educational programs once they're back in their virtual classroom.
Howard, just another minute or so with you. Anything else you'd like to talk about today before we let you go?
No, I listened to Coach Bellamy. He's very impressive. I'm excited for the students. I'm hoping that everybody stays safe. I appreciate you having me on here. I'm I'm pleased that of what the Megacast is doing. All of you are doing a wonderful job keeping us informed, and I appreciate that. And if there's anything else I can do to help you, feel free to call on me.
We appreciate that. Thank you very much for being with us today, Howard.
My pleasure.
Appreciate having you on. Howard Rosenberg, West Bloomfield Township Trustee and DIA docent volunteer with us on the Oakland County Megacast as we continue to inform the community about coronavirus information and more, including our coronavirus information online on civiccentertv.com/coronavirus, where we have links to reputable resources on COVID-19 on a national, state, local, and federal level, as well as our top stories of the day. And interesting, we talked earlier on in the week about the beginning of the Moderna vaccine trials in partnership, partially partnered with Henry Ford Health System in the local area. And one of our stories today on civiccentertv.com/coronavirus, 30% of Michiganders are reluctant to take the free COVID-19 vaccine for the trial. In an epic MRA poll conducted for Bridge, Michigan magazine of 600 quote-unquote active and likely voters, approximately 30% of those polls said they would either probably or definitely not get vaccinated if a vaccine was developed and made available free to the general public in the case of a trial, with 66% stating that they probably or definitely would get the vaccine among those who answered the same question. Additionally, among those surveyed, just under 50% expressed concerns about the vaccine being rushed and quote-unquote not sufficiently tested, with one person surveyed being quoted in the Bridge Michigan magazine article saying, quote, "As much as I wish the vaccine was the miracle we're all hoping for, it is being rushed." She said, "As much as I wish the vaccine was the miracle we're all hoping for, it is being rushed," and closed quote. Phase 3 vaccine trials have begun for multiple potential COVID-19 vaccines, including the Moderna mRNA 1273 coronavirus efficacy, or COVE, vaccine study, which includes participation from Henry Ford Health System. So, Erica, some reluctance for people who are potentially able to join the Moderna vaccine trial or other vaccine trials, or even get a vaccine in general if it were to be done at this point in time, as these trials have been expedited and have been able to move a lot quicker than normal. There are some concerns that it's not about the efficacy of these vaccines. That being said, we're still a long way away from them being available to the public. I'm sure that opinion such as we've seen in this poll will be different by the time a vaccine is done and ready to be distributed to the public.
Yeah, it's very hard because we had a guest earlier this week, a medical expert, say we cannot compromise safety and integrity of a virus for speed. And again, as much as we would like it to be magic and a miracle, that's just not realistic, and that's not the way science works. And it's crazy because in the past, other vaccines have taken upwards of 10 years to be tested and developed. So to think that we could have one within a year is almost too good to be true. And I understand why a lot of people, me included, honestly have reservations. And I don't know if I would be so quick to do a trial within 6 months, not knowing potentially what the long-term effects is. And we want to trust our top medical professionals, but inevitably there are going to be some concerns with that.
And there are valid concerns as well. But if you are interested in joining that trial through Henry Ford Health System, look up Henry Ford Health System's page, and you'll be able to find more information on that. And if you want to watch the interview Erica was talking about, we spoke with Jason Wasserman from Oakland University's William Beaumont School of Medicine about developing vaccines. He's a bioethics expert there. He is not a medical doctor, but he is a bioethics doctor, a doctorate of bioethics, and he explained that we have these social distancing measures in place, we have mask wearing measures in place, the preventative measures are there, so there is an opportunity to take a little more time developing a vaccine and make sure that it is an effective vaccine and it is a safe vaccine before there's not really a cause for a rush to move it to the general public. That being said, many COVID-19 vaccines are in phase 3 trials and are on the fast track to being completed. Lastly, civiccentertv.com/coronavirus, as many people voted by absentee ballot in the August primaries, and and had to hand deliver their ballots to their local clerks because of issues with the U.S. mail. Senator Gary Peters is opening an investigation into Postal Service cuts. Michigan U.S. Senator Gary Peters, who also serves as a top-ranking Democrat on the Senate Homeland Security and Governmental Affairs Committee, has opened an investigation into cuts to the U.S. Postal Service as delays in processing and delivery of mail have continued to be issues across the nation. On Thursday, Peters encouraged people to contact his office regarding issues in the delivery of mail and is quoted in an article by the Detroit Free Press's Todd Spangler saying he would, quote, he would be, quote, working to get to the bottom of any changes that the new Postmaster General may be directing that undercut the Postal Service's tradition of effective service, and closed quote. Many clerks, including Oakland County Clerk Lisa Brown, had recently encouraged voters to hand-deliver their absentee ballots to their local clerks as the August primary election approached, concerned that those voters would not be counted if those votes were delivered beyond the poll closing times, which were the deadlines on Election Day. About 2.5 million people voted by absentee ballots on Tuesday's primary election, and initial statistics show about 10,000 ballots were rejected, although it is not clear at this time how many were rejected due to late arrival to their local clerks versus other issues such as a spoiled ballot because they were not following the single party voting rule and so on. That story and more, civiccentertv.com/coronavirus. In addition, we have links to information from the Centers for Disease Control, the state of Michigan, Oakland County, and your local municipalities about the coronavirus and much more. And we thank you for joining us each and every day, 10 a.m. to 12 noon on the Oakland County Megacast, as we also continue to talk to a variety of people in the community about how the COVID-19 pandemic has impacted them. It's impacted different industries and different people in much varied ways from others. And joining us now to talk about that from an author's perspective, we're pleased to be joined by Alexa Randolph. She is the author of Being Forever Strong with Alexa Randolph with us on the Oakland County Megacast. Alexa, thank you for being with us today.
Hi, thanks for having me.
Appreciate having you on. How have you been over the course of the pandemic?
I've been okay, hanging in there. I have gotten some really cool things done, like for my business and my brand, so that's been really fun, and gotten to meet really cool people through Zoom. So I've been keeping busy that way. But yeah, I've been doing pretty well.
So
How about you guys?
We've been doing well here as well. We appreciate you asking. So Alexa, we've had you on our older program around the station. We've had you on the Splash before a couple of times. Talk about your previous books and your previous experiences as an author. For those who are tuning in to the Megacast or are meeting you for the first time through this show, explain how you kind of got into writing and how you got into writing these books and publishing these books that you make.
Yeah, so I started back in 2014, I think. It was my junior year of college. It was on break, and I was just like relaxing. All of a sudden, I had this idea for characters in a story. So I ended up just starting to research and write, and it just kind of came to me. And I worked on it for about a year and a half for With Love, Ella. And I actually, in between, after I graduated college, I actually got into a bad car accident. And was a lot of people like through my blog that I'll talk about right after, but I was able, because for a while I couldn't work, so it actually helped me to get the books really written and published through Amazon. I worked with a great writing coach and editors, and then I also, a year later from that, actually did the sequel. It's With Love, Ella and Daniel Ever After. It can also be purchased on Amazon. So during that time, I also was suffering from chronic pain due to a mild traumatic brain injury, and I started the blog called With Love, Alexa, which is also under like my Be Forever Strong campaign. I think with invisible illness, whether it's mental health, pain, it can be really hard for people to understand because they can't see it. So my slogan or my everything that I do is just to be strong through it all and to I want to help others that maybe can't advocate for themselves.
So you write a blog, you mentioned that as well. In that blog, what kind of topics do you cover, and what can people expect or maybe get from reading what you write?
So it's like a lifestyle brand for invisible illness. So I talk about fashion because sometimes it can be hard to wear certain clothing due to like my nerve issues. I've talked about travel and like different tips and tricks on traveling with pain. I talk about like just daily living. I talk about the grief process and relationships. So it's like a little bit of, it's like a bubble.
So, and that's kind of a theme with a lot of what you write, is taking the experiences of what you've been through and what many others experience that's similar to what you've been through, and identifying with those people through these characters that you write. What are some common themes that you see that readers can expect to learn or engage through reading your books?
I would say definitely like overcoming challenges, to advocate for yourself and all as well, and can love conquer all.
Alexa Randolph with us. She is an author of Being Forever Strong, with Alexa Randolph with us on the Oakland County Megacast, on a family of TV and radio stations all throughout the Oakland County area. So Alexa, this new book you've written is called Be Forever Strong. What is this about, and how does it differ maybe, or is it a continuation of your previous stories?
Oh no, sorry, I didn't. No, it's not my. That's not my book. It's just like my brand. I'm sorry.
Okay, that's okay. So, how has your process of writing been modified in this case? Let's move on to how has your process of writing been modified maybe by the experiences of the pandemic? Do you write more? Do you write more often about differing topics? Are you engaged with other people and telling other people's stories on top of yours? How have things changed? How's that dynamic been altered by the COVID-19 pandemic?
Yeah, I definitely do my best to write as much as I can. I kind of switched a little bit from my books to my blogs just because that was easier for me in the time, and it was more helpful to me. So I kind of transferred a lot of that. And yes, I'm like talking about other people's stories, and I even have a YouTube show called Staying Strong, which is another way of sharing other stories. So I do my best to continue to write as much as I can.
So I can't help but noticing you have this super cool sweatshirt on. Is that representative of your brand? It has the little infinity sign. Can you tell us about that?
Yeah, so this is actually a sweatshirt I'm designing. It's hard to see, but the sleeve has Forever Strong down it. And I'm going to hopefully be selling some of this kind of stuff on my website soon.
Well, Alexa, on that note, where can people find more information about your books, about your blog, about your brand, and your message that you're sending to people in the community to be forever strong?
AlexaRandolph.com. It's www.alexarandolph.com. Everything is there.
And just before we let you go, just another minute or two with you, is there anything else you'd like to speak on today? Anything else that you believe would be important for our audience to know?
Just hang in there. Times are tough right now, but we're all strong individuals, and we just need to lean on each other and just be positive as much as you can, and talk to people. If you're struggling, don't struggle alone. And I'm always here. My website has my email and everything. So if anyone ever is struggling or just needs someone to hear them, I'm always willing to listen, and wear your masks.
Well, Alexa, thank you very much for being with us today.
Thank you.
Appreciate having you on. Alexa Randolph, she's an author and runs the Being Forever Strong brand with Alexa Randolph with us on the Oakland County Megacast. We appreciate having her on. We're going to take a quick break. We'll come back. We'll wrap things up, give you some more information about what you can get from our website assets about COVID-19 and other important information in the local area. You're watching and listening to the Oakland County Megacast on our family of TV, radio, and other media outlets. Erica and I will return after the break.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our Test Locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Erica Jones in the studios of Civic Center TV and 89.3 Lakes FM. As always, we're on 89.3 Lakes FM, 88.1 WBFH out of Bloomfield Hills and Birmingham Area Municipal Access. Today it's an OU Friday, and we've been glad to be joined once again by Oakland University as our Facebook partner on today's edition of the Oakland County Megacast. Just a couple more minutes left in today's program before we will say goodbye for the week, and I want to remind you of where you can find all the information on our show and on COVID-19 directly from civiccentertv.com. So, of course, civiccentertv.com. If you click on our coronavirus link or go to civiccentertv.com/coronavirus, you'll find our top stories of each and every day where we put up there before all of our shows, our top headlines about COVID-19 and other important news stories, as well as links to the coronavirus information from the Centers for Disease Control, the state of Michigan, Oakland County, and many different municipalities in our coverage area. So if you're a resident of Birmingham and you want to know information about COVID-19 from your home city, you can click on the Birmingham link on civiccentertv.com/coronavirus, and there it is, all the information you need to know about the city of Birmingham's response to COVID-19. But if you want more general information from the state level, what's going on with the Michigan Safe Start Plan, you can find that information on our website by clicking on the State of Michigan page. All those coronavirus-related links on civiccentertv.com/coronavirus, as well as on civiccentertv.com/megacast. We can find more information about our partnering stations and about the show. Watch full episodes and full interviews, as well as short clips from each and every one of our programs here on the Oakland County Megacast. We recently spoke with Dr. Jamie Tawil about getting those health screenings that you've been putting off during the course of the pandemic and how critical those are to your continued health, as we had previously spoken before him with Jennifer Hammond from Fox 2 about the tragic passing of Jamie Samuelson at the age of 48 to colorectal cancer. Here is what Dr. Tawil had to say on yesterday's program.
Every patient should be getting yearly physicals, and during those physicals should be getting age-appropriate cancer screenings. So, for example, a female who hits a particular age will start getting, asked to get mammograms routinely because those are other preventable cancers. Men will also start getting prostate screenings as per the guidelines as they come out to, age-appropriate screening, and colonoscopy is one of them. Now, a colonoscopy, typically, there's different, the American Cancer Society released new guidelines suggesting that everyone at age 45 and above gets screened. The gastroenterology guidelines are still at age 50, but you can make a case for 45. So at age 45, you start getting screened for a colonoscopy, and it's typically, every 10 years, but sooner if they find something on that colonoscopy that would require a little bit more of a closer surveillance, so to speak. There's cases where you would need to get it before age 45, and that would be if you have the pre-existing conditions, genetic predispositions for colon cancer, such as FAP. These are like genetic mutations that create a lot of polyps that could be potentially cancerous. If you have an inflammatory bowel condition like Crohn's disease or ulcerative colitis that puts you at higher risk for colon cancer, that needs to be routinely screened. And a first-degree relative with colon cancer. So if you have a brother or a sibling or a mother who has had colon cancer, your screening begins 10 years prior to that, the age of diagnosis, or the age of 40, whichever comes first. So if someone got diagnosed, let's say your mother got diagnosed with colon cancer at age 53, your first colonoscopy should be at 43 or 40, whichever you hit first, and that being the case.
Dr. Jamie Tawil with us on yesterday's edition of the Oakland County Megacast. You can find that and more clips online, civiccentertv.com/megacast. And we thank you for tuning in today. Appreciate all of our guests, Nancy Jensen, Cynthia Jones, Ron Bellamy, Howard Rosenberg, and Alexa Randolph for being with us today. Our crew, Larry Nyland, Jake Kustash, Ryan Younglove, and of course, Ronnie Dole each and every day. For our entire team, including Erica Jones, I'm Tyler Keefe, thanking you for tuning in. The Megacast will return with new episodes on Monday.